I want to thank you for having me with you this afternoon. And to get us started, I'm going to have you settle back in your chairs. I'm going to ask you to imagine. Imagine a day in your life in the last week. You wake up, you brush your teeth, prepare your clothes for the day. You pour yourself a cup of coffee. You gather your coat, your bag, your keys. Perhaps you're going to meet friends today, or family, or colleagues at work. You navigate familiar streets, familiar neighborhoods. At the end of your day, perhaps you pick up some groceries. You return home. Everything is just as you left it. You set your groceries in the refrigerator. You have a meal, perhaps on your own or with others. And then you rest your head on your pillow, prepared for a nice, restful sleep. Now, I'll ask you to imagine waking up in the dark with a pit in your stomach and the knowledge that something has changed and you are no longer safe. As you look wildly around the room, around your home, I want you to imagine what belongings you would take with you to pack a backpack about this size, because that's all you can take. I want you to imagine who you would tell that you're leaving forever. Who would you say goodbye to? I want you to imagine which of your family members you would take with you, because no, they can't all come. And I want you to imagine as you close the door on your home for possibly the very last time, you close your eyes and you take a mental picture of your life, your community, your family, your friends, everything you hold dear. And you'll carry that with you as you walk away from everything you know. What I've described to you is the plight and the beginning of a glimpse into the lives of over 70 million displaced people around the world. These are some of the highest numbers that the United Nations High Commission for Refugees has ever documented, and these numbers are only growing each year right now. Of those 70 million displaced people, almost 26 million are refugees. Who is a refugee? A refugee is someone who, for reasons of race, religion, nationality, belonging to a particular political or social group, has a well-founded fear of persecution, and they cannot return to their countries of origin. It might not surprise you that the world's refugees come from countries like Syria, Afghanistan, South Sudan. But it might surprise you to know that most of the world's refugees are housed in countries like Turkey, Pakistan, Uganda, equally low-resourced, struggling to manage and to care for this important population. So what is Canada doing? Every year, we accept about 280,000 newcomers to Canada. And of that group, about 40,000 are refugees. We know that the plight for many refugees is one where they've had disruptions to their healthcare, disruptions to their community, to their families, Many have traversed dangerous and violent journeys. But on arrival in a host country, like Canada, there are new stressors, new challenges. Imagine holding documents in front of you in a language that you cannot understand, knowing you need to complete these documents, fill them out, read them, in order to see your lawyer and advocate for your right to stay in Canada, or to enroll your children in school. Imagine the stigma of knowing you look different, you sound different. The food at the grocery store isn't familiar to you when you want to make a meal for your family, and that your children haven't even seen something as simple as snow before. Imagine struggling on the poverty line, choosing every day between dollars that you might spend on TTC to travel to see your doctor or your lawyer, or that you could allocate towards groceries for the week. And imagine the challenges of sitting in a classroom, learning English as a second language, knowing you have to master it and master it swiftly so that you can find employment to feed your family, and knowing that your credentials from your home country aren't recognized here. These are some of the challenges that many of our patients at the Crossroads Clinic at Women's College Hospital face. The Crossroads Clinic is the first hospital-based clinic for refugees in Toronto, founded by an incredible colleague of mine, Dr. Meb Rashid, a colleague, a friend, a mentor. We opened in 2012 at Women's College Hospital as a team of 3, and now we're a team of 11. We have grown. And over that time, we have seen 4,500 refugees new to Toronto, 500 new patients in 2019 alone. And of that group, almost 50% identify as women, 25% are under the age of 19, and almost 50% come from countries that originate in Africa. Our team is a comprehensive team providing family medicine and primary care. We support our patients in navigating the healthcare system and all its challenges and all its barriers, and help break those down every day. We learn from our patients. And what's amazing is every day we learn from our patients how to do our job better, and we believe in harnessing the power of education. We have medical students working with us. We have doctors who will become the family doctors of tomorrow working with us. We have global health fellows who want to work with marginalized populations in the future and want to learn how to do that better. We are an affiliate with the Department of Family and Community Medicine as a teaching site, and we are privileged to share what we know about refugee healthcare with our colleagues who come from China, Brazil, Chile, interested in learning about migrant and refugee health, because they too believe it's a priority in their own countries. How can we share the lessons learned? This is some of the work we're doing at the Crossroads Clinic. And since 2013, I've also had the privilege of thinking about where our patients come from. Many of our patients at the Crossroads Clinic come from Ethiopia, actually. And in 2013, I had the privilege to become part of the Toronto-Addis Ababa academic collaboration in family medicine. This partnership is a partnership between the University of Toronto, Department of Family and Community Medicine, and Addis Ababa University in Ethiopia. This partnership has been supported by our former chair, our current chair of department, and a whole host of department colleagues in family medicine and several colleagues here at Women's College. In my role as program faculty lead, I've had the privilege of supporting our colleagues, along with many here in the department, in Ethiopia, in developing the first family medicine training program in the country. Over the last 7 years, it has been an absolute privilege to watch the new graduates from the program in Addis Ababa become the first family doctors in Ethiopia. They are a bold, courageous, and pioneering group, and it is an honor to work alongside them. They are visioning out what the future of family medicine looks like for their people in their country context, and we are a part of that. So now, I'll ask you to imagine just one more time. Imagine a world where refugees can come to Toronto, to Montreal, to Vancouver, or to any small municipality in Canada, and imagine that they would meet family doctors, primary healthcare provider teams who are skilled and nuanced in the care of refugees, because we've all had a chance to share the lessons learned. Imagine that as refugees arrive here in Toronto, they can rest assured that their families back home have access to emerging family medicine and primary care, advancing yet one step closer towards health equity. And last of all, I'll ask you to imagine your part in that story. Imagine supporting the work we do here locally towards an upstream and global impact. Thank you.